So this is our recap, and hopefully now to start getting people to think about next steps and developing new resources. Always have to figure out how to do that. I would like to acknowledge that I joined today from the traditional lands of the Anishinaabe, the Haudenosaunee, the Lenape and Chinookan nations in what is now called London, Ontario, and pay my respects to elders past and present, and really convey my sincere gratitude for the privilege to live and work on this land and try to orient my work in ways that are helpful for reconciliation and do not replicate stereotypes about Indigenous peoples. Today's learning objectives really are to sort of summarize the principles of TVIA that we've gone over in the past few webinars and bring in the expertise and wisdom of the colleagues that I worked with in previous webinars, Hiroko and Millie from Empower and Seed, around how these apply to financial literacy education and discussions of financial literacy, and explain how especially organizations and programs need to take responsibility for enacting and supporting TVIA strategies among direct service providers, educators, facilitators, et cetera. So I always try to go to structures and really promote the organizational role in ensuring that these things happen, and then really provide some ways to get started. And as Rebecca mentioned, we're excited to tell you about some new resources that are coming. So in the first webinar, I briefly introduced Elaine, and I just wanted to bring Elaine back into the discussion. So this is just a brief scenario, and it's a situation you might have found yourself in as a financial literacy educator. You've just started working with Elaine. It could be in a group or in an individual one-on-one session. She came to you from a referral from a local domestic violence service. She arrives at the first session late, doesn't apologize or explain, and really doesn't seem connected or engaged with what you're saying. When she leaves, you're a bit frustrated. You call later, you leave a message, tell her when the next session is, but you don't hear back. And when the next session arrives, she doesn't show up. So I just sort of want to leave that with you. You can sit with it. And as we work through some of the TVIA content, you might think about the frustration that you're experiencing and then how you might reframe that to better support Elaine in her financial literacy journey. So supporting women on financial literacy journeys is something I've been really impressed with. I've learned a lot, I have to say, in working with Rebecca and the folks at Families Canada, and learned about programs such as Each One, Teach One that are really person-centered and community delivered. And I think all of the programs that I've learned about, the strategies from Hiroko, Millie, and others have really impressed me in terms of how well they align with a trauma and violence informed approach. So it's not difficult, I don't think, given the philosophy behind these programs, to sort of tweak things a little bit to really attend more to trauma and violence in the lives of clients and learners, and really make those services well aligned with trauma and violence informed approaches. So I note here that most programs are set in trusted community service agencies or community spaces, and facilitators are there to support women and families, not to sell products. And I think those things align really well with TVIA. I do always start by putting out there and really addressing the fact that many of us are feeling very, very tired these days. That this notion of emotional labor and even moral distress and burnout are even more exacerbated through the COVID-19 pandemic and the responses to it. But even prior to that, these feelings can be caused when the reasons that we come to our work, whether it's supporting women and families or doing nursing or other forms of social service, we come with a certain set of expectations and values and ethics. We want to do good. We want to help people. And sometimes the systems that we work in don't enable that. And this can be increasingly felt as emotional labor as we try to bridge those disconnects between what we and even our professional codes of ethics say we need to do, and then what we're actually able or allowed to do in our work settings, but can even accelerate when we feel the clients are being harmed or poorly served into moral distress and eventually even burnout. And I sort of do this TBI work across different sectors, and I'm hearing it everywhere. So if you're feeling that way, and if you're feeling that some of these problems, especially when we get into social problems and structural violence, feel too big to solve, you're not alone. But what I think we're trying to do with this work is say, they might be big, they're going to take all of us to solve, but there's still things you as an individual and you as a program leader or organization can do And that's what we're really trying to talk about here, is articulate some of those actions. But I do want to acknowledge that it's hard to talk about these things. The work is difficult. It makes you reflect, makes you think about your past role, your ongoing role, and maybe how you might do things differently. So if you're distressed, please step away, but embrace the disruption, I think is what we like to say, because unless things change, if nothing changes, nothing changes. So we need to disrupt things a little bit and promote that change. So in the first 3 webinars, I made some key points. I went through some of what I call trauma and violence 101. And we talked about the fact that trauma and violence are highly prevalent in our society and across different societies and countries. We see this from global health surveys and so on. And what trauma looks like in your practice, in your educational sessions, in your one-on-one sessions, et cetera, can be different depending on people's, various life circumstances and their own physiology. So we talk about fight, flight, freeze, and fawn, and how this presents can be different in the same person from one time to another, and certainly can be different between different people. So we can expect a range of behaviors, and we need to be attuned to those. We also talked about the fact that some forms of trauma, and I, as Rebecca said, come from research in gender-based violence, particularly violence against women. Those forms of violence can be particularly problematic because they are often ongoing, they're chronic, and they are complex because they involve really the breaking down of trust in attachment and relationships. And the earlier in life this happens, the more difficult it can be for people to then form safe and trusting relationships later in life. And you then can even see this in an intergenerational way, where people who grow up in families that are disrupted with violence and trauma may themselves not be well prepared to parent their own children. So you see this perpetuating in intergenerational cycles. And our trauma responses are physiological. So they involve changes in our brain and our body. And that's important to know, because when we start thinking about judging people for the way they're behaving, if it's not controllable, if it's a physiological response, we need to sort of understand and find some space and some compassion for that. So the little graphic I have at the bottom here with the arrows basically is saying that different forms of trauma, including forms of collective and historical trauma, can intersect with situational forms of trauma like accidents or sort of acute traumas, as well as these more complex interpersonal forms of trauma. And experiencing one form might make you more or less, probably more likely to experience other forms of trauma. So there is a bit of complexity there as we see how these different experiences interact. And then we get into what the V does when we add violence to trauma informed, because I would say in our reviews of literature and so on over the last few decades, trauma informed practice is certainly something that's been around, but we intentionally add the V for violence, and that is to bring attention to these structural and systemic issues. And these are, a few of them are highlighted in the bubbles on the right of this slide here. And again, these are big things in our society. So why is it important as an individual provider to pay attention to these things? Well, first of all, it helps you understand what might be happening in somebody's life and how that might be presenting in your service, but also to reflect on your own approach and your own feelings and thoughts and perceptions about these issues. Because we might have what we could call implicit or maybe explicit biases. We might carry certain stereotypes and attitudes about certain groups or individuals or their behaviors. And this can be experienced by those we serve as dismissal and discrimination. Even if what you're trying to do is not say the wrong thing and you say nothing and not engage with somebody, that can be experienced as dismissal because many people have had pretty bad experiences in different services when these biases are present. So we do try to encourage people to think about themselves as part of a trauma and violence informed intervention because their interactions with people from the get-go in a service setting are very important in terms of setting the stage for how that person will then engage with the service. And if that doesn't go well, that can impede program success. So there are things you can do as an individual, and that's what we're trying to support through our TVI work. And actually, this was added because of a really good question in one of the early webinars about the difference between equality and equity. So I did want to briefly reflect that when we talk about trauma and violence informed care or trauma and violence informed approaches, we sort of use the word care in some of our health and social service work. it is one of what we call the key dimensions of equity-oriented care or equity-oriented services, recognizing that equity means that some people will need a little bit more because they've started with a little bit less. And that's sort of the tree diagram, and really starting to understand that if you are working from an equality perspective and you give everybody the same thing, but some people already start with a lot more, you're not actually going to get people to the same outcomes that you want. And then the third, the middle tree sort of shows that some parts of the tree don't even have apples. So if we really want to get to structural equity, we need to make sure that there are apples available across the tree for everyone to have. And in terms of our other key dimensions, and I actually think the TVI approach really brings in these other two issues, is a focus on cultural safety and anti-racism, recognizing that an extremely harmful form of bias and discrimination that is happening in our health and social services is around racism and xenophobia and other forms of othering. And also the stigma that comes with people who use substances. So we really want to focus in on stigma through a harm reduction lens. So adding the V really shifts the lens from a trauma-informed approach. So it gets at these broader social conditions, these structurally violent conditions that can harm people. It makes us attend to the fact that trauma can be in the past, but it can also be ongoing and it can be collective. And at this point, I reflect on the ongoing harms of policy and other factors on our Indigenous peoples in Canada. We can embed these harmful practices in institutional policies and protocols and systems as a whole. So that's when we can talk about systemic or institutional violence. And we need to attend to the safety and well-being of providers. As I mentioned before, when there's that mismatch between your values and your ethics and what you're able to do as a provider, you can start to burn out and feel very unsafe in your work. So we really need to bring that safety concept to providers, teams, and whole organizations. So then we're getting into culture shift and organizational change. I think the other important thing that this does is also help us understand that some responses to trauma and violence can be anticipated. They're not expected. Like, not everyone, behaves in the same way. And we certainly want to promote protective factors and resilience and people surviving and thriving traumatic experiences. But there are certain things that are associated with having experienced trauma, things like substance use and smoking and mental health issues. And those themselves are stigmatized and can be sources of discrimination. So you can sort of see the stigmatization and the judgment built into when people are using these behaviors to maybe alleviate some of the symptoms of their trauma response. So again, shifting from judgment to compassion is important here. And also shifting the emphasis from what's wrong with people, so what happened to them that made them not well now, to what has happened and is still happening in the person's life. So bringing in that structural lens, the conditions of people's lives. And then, as I mentioned, understanding that some forms of trauma and violence are complex and chronic, and also sort of might change the way people are able to trust and interact in service settings. We articulate all of what I've just said into 4 principles that we found to be quite simple and adaptive and tailorable to different contexts. So these are the 4 principles of TVIC. We do emphasize a focus on structural and systemic forms of violence when we talk about helping providers and organizations understand trauma and violence and how it impacts people's behavior. And we want organizations and providers to focus on actively countering discrimination and stigma. As I've mentioned, it is the stigma, including the self-stigma that people experience, that really can be a barrier to them seeking care and finding that pathway to safety, to financial well-being, to health, and so on. So we want to really focus on creating those emotionally, culturally, and physically safe spaces for interactions to happen. And the third principle is really about being person-led and person-centered and understanding what they want, what their priorities are, not imposing your own priorities, and then connecting with them to collaborate on options and next steps. And to do that, it's very helpful to find people's strengths. So if you can have a conversation that really gets at how people have, survived and thrived and been resilient in the face of trauma and violence, you can start to build on those strengths and then build capacity. So the next 4 slides, I'm going to go through quite quickly. I've included them mainly so you have them in the slide deck when we send the slide deck out. But they're just a little bit more detail on these 4 principles. And what I want to do is actually get to what these look like in financial literacy education contexts based on the excellent input that we got from Hiroko and Millie. So again, this is the first principle. Key thing here is that the organization has to set the stage for providers to do things in different ways. So this is about really understanding trauma and violence and taking that sort of structural and systemic lens. And it's up to the organization to develop a culture that supports providers behaving in these ways, where they can understand what's happening and what these red flags are, the fight, flight, freeze, fawn, and then to handle disclosures and also provide options that are appropriate based on an understanding of trauma and violence. The second principle is about safety for the provider, as well as safety for the program participant or client. And you'll see we use different language and try to make it as generic as possible for the different contexts in which we work. So in this one, and I'm going to tell you a bit more about the trauma review or trauma walkthrough later on, but it's really looking at your space and looking at how your program participants are experiencing your services, and also how your staff are experiencing your services, to make sure that there is that cultural, physical, and emotional safety, and you're setting things up in a way to promote that. In the e-learning, which we'll talk about in a little while, that Rebecca will introduce, we provide things like strategies for online sessions to promote this sort of safety and that sort of thing. So just new ways to think about a broader sense of safety for everyone involved in an interaction, and how to embed that into your organizational and program culture. And again, for the provider, it's things like really intentionally focusing on being non-judgmental and finding compassion and using language in ways that are inclusive and safe. And I'll give you a couple of examples of those. The third principle is about opportunities for choice, collaboration, and connection. And again, at this point, we really start to encourage the organization to think about being flexible in how time is used by direct service providers or facilitators or educators in those interactions with clients, or in how they set up a group, and trusting them to have the expertise and the judgment to make changes on the fly. So you might have an agenda for a group. I think I remember Millie talking about this, going into a group and saying, you know what, I had the agenda, I thought I knew what I was going to say, but the needs of the group really emerged, and it became clear I had to shift things as I went along. So the organization has to enable that for providers and trust providers to use their judgment in those ways. And again, this also sort of gets at making sure that people kind of know how they're expected to engage and what the expectations are for a program or service. And for people who have experienced trauma, and really for any of us, knowing what's coming is a very comforting thing. It might shift a little bit, but if we know what's coming, we can anticipate, we can monitor our own reaction to it, and so on. So that's just generally good practice. And again, from a provider level, when you understand the broader circumstances of people's lives, for example, if they are living in poverty, or if they don't have, realistic options for banking services or legal services, that's something you have to talk through. So just providing a standard set of referrals where actually that person is not going to be able to have transportation to get to that referral, or there's a 3-year waiting list for that sort of therapy, those aren't really realistic and appropriate referrals. So that, that connection, that collaboration with the person, understanding what their priorities are, and then really thinking through what are realistic choices for them, is what we're talking about in that third principle. And the fourth one, as I mentioned, is really finding people's strengths. I've worked a lot with, in the area of gender-based violence and intimate partner violence, and women do an extraordinary amount to keep themselves and their children safe. And if they do decide to leave, when that time comes, they know that it's a time of high risk, and they know that they will need to, embed additional safety strategies. So asking what's kept a person safe, throughout the time of the abusive relationship is an important thing to ask, because then you recognize that strength, you validate it, and you can build on it to see what might be an important next step to ensure safety as a transition to leaving a relationship might happen. So you want to listen for those strengths. You want to ask about things that have worked for people, and then sort of tie that in with their needs and priorities in terms of building capacity for next steps. So those are the 4 principles. And I just want to, again, talk through how to get started and then link that to what Millie and Hiroko told us about the financial literacy education context. So if you're looking for the next step in your journey, I would really recommend the trauma review exercise or equity walkthrough. They're quite similar. The equity walkthrough is through our Equip Healthcare work, and the trauma review is posted at our Gender Trauma and Violence incubator. They were co-developed by the same group of people. They have slightly different focuses. The equity walkthrough includes a little bit more around those 3 key dimensions of equity-oriented care that I mentioned. And it has this fancy video that's at the bottom right here because we had budget in that project to create some of these tools. It's also available in French, actually. So that might be a consideration for those of you working in Francophone contexts. So this is a good place to start, just for yourself as an individual, and hopefully ultimately with your team, with your program, with your leaders. The other thing is, ask people who are using your programs and services what works for them and what would make them feel more safe in your educational sessions. That's a really good way to find out what's working and what isn't. As I mentioned, using trauma and violence informed language is the first and probably most important thing to get a relationship or an educational session off to a good start. So here are a few principles. In our e-learning, we will have quite a bit more of this, but really it's about labeling behaviors, not people. So that's called being person first. So you want to talk about what people are experiencing, not label them as something, because if you label them, it doesn't give you the idea that things can change, right? So I've got an example here, a woman who's experiencing violence rather than an abused woman. And you want to use language that conveys optimism and hope. So survivor is more hopeful and optimistic than victim in the context of somebody experiencing violence. And again, focusing on a person's autonomy and the fact that they know their path, they're the expert in their own life, and reflecting that in your language is important. So we often see this in documentation as well, that somebody will put in a chart or in a note after engaging with a client or a patient, non-compliant or non-adherent to treatment. That is a very judgmental way to put things. It doesn't really take into account why somebody might not be able to follow particular recommendations. So maybe reframing that into something like, she's not choosing this path right now, or she's decided to go in a different direction, would be, a more trauma and violence informed approach to somebody not following your recommendations, especially if your recommendations weren't very trauma and violence informed in the first place. And again, using language that reframes responses to trauma as normal and does not judge those responses, and bring in that strengths-based and future-oriented language. So I've got an example here at the bottom, and we'll see that in a moment here in my Elaine case. So here are some of the individual level strategies. So at the level of educational facilitators that Millie and Hiroko shared with us. So I've just sort of summarized these in the slide. So as a facilitator, you want to look at your space, and again, the trauma review is good at this, and create a welcoming and non-judgmental and inclusive learning environment. So if you're in a community center, you want to think about how you're setting up the chairs. If you're in an online environment, you might think, do I give people choice as to whether their camera is on or off, choice as to how to engage? Maybe they can put it in the chat if they don't feel comfortable speaking up, in a video, and so on and so forth. So really think through those things. Is there something else going on if you're in a community center, for example, that could be disruptive or distressing for people, something loud that might be happening? Is it clear where the washrooms are? All those sorts of things that make people feel that they're important and that they are where they should be in terms of engaging with your program. I mentioned before, being clear about what you hope to achieve so people know what the expectations are, and giving them a bit of control over how they engage. So I mentioned, in an online environment, you might say you can put it in the chat, or you can raise your hand and speak out loud. So then they have that option for engagement that is comfortable and safe for them. I think we heard from Hiroko that we want to normalize people's money management challenges and not make it seem that they're unique or exceptional, that people struggle at different times, and you're going to have ups and downs. And when you have good successes, we need to celebrate those. And any personal plans and strategies really need to be based on a person's own needs and priorities, not what the program delivery person or the educator thinks is the most important thing for them, but you have to listen to hear what is important for them. And we also heard, I think it was also from Hiroko, people might choose to ask questions or engage in the third person or sort of depersonalize a context. So I've heard that some, women do this, or I had a friend who talked about this, and that's fine. I mean, the idea is to get the information out and to start having that engagement. So that can be pulled through either within sessions or before and during after sessions. So when we think about Elaine's relationship, we know that Elaine came to us through a domestic violence service, and you start to think about, the impact of that trauma and violence in Elaine's life. And you start to realize that that abuse might make it hard for her to attend sessions. And when she is able to attend, might make it difficult for her to engage in a way that you expect. So if she's in a freeze mode or disassociative mode, she might look like she's not taking anything in, and that could be quite a normal trauma response. And again, sort of thinking about more structural issues, you might take that TVI lens and you start to think about, wow, well, what's impacting Elaine's financial situation here? Well, there could be situational poverty. She's thinking about leaving this relationship. Her husband's the primary wage earner. What's it going to mean for her own finances if that happens? We also know a lot about financial abuse and coercive control as features of many abusive relationships. So Elaine has never really done the finances in her relationship, has no credit score, no financial documents, because her husband has controlled all of those things for the course of their marriage. And then you might think and put yourself in Elaine's shoes about, okay, if she does leave this relationship and finds herself in a much more difficult financial situation, how is she going to get back into the workforce if she hasn't been in the workforce for a while? What about things like ageism and gender pay gaps and minimum wage laws that might impact how Elaine thinks about getting back into employment and financial independence? So again, just putting yourself in Elaine's shoes for a minute and thinking about the different ways in which structural violence can impact her decisions will help you and Elaine develop a strategy that is based on her needs and her concerns. And when you're interacting with Elaine and sort of, might come up that she's using alcohol to cope with some of the stressors, arising from the abuse, how would you start that conversation? So here we have not a trauma and violence informed approach to that conversation. And this person, this facilitator might really have the best of intentions and is basically saying, Elaine, you're spending too much money on alcohol. It's really, impacting your budget. And really what you need is some counseling. So here's a referral to AA that I think you should take. There's not a lot here about Elaine's priorities. There's some judgment here. And this is not really about choice and autonomy for Elaine. So we would say a more trauma and violence informed approach to that conversation is to, validate the courage that it took, the strength it took to even be here, having this conversation and finding a path, and then look for those strengths. What other strategies have worked in the past to help you cope? And how can we together find an approach that manages your needs and your budget? So that is a much more trauma and violence informed way to start the conversation and to start to develop connection and trust in that relationship. For programs, Hiroko and Millie talked about, again, thinking about space and not only safety for learners, but safety for staff. So when you're selecting space as a program lead, is that space appropriate for everybody who's going to be expected to be in it? We heard a lot from both of them about the principles of adult learning and aligning your programming to those principles. I talked a little bit before about, trusting facilitators to be flexible in how they deliver content. So that it really reflects the needs of the person or the group that they're working with in that moment. And then as a leader, you might think about how to support your staff and also to improve service by creating that culture of reflective and effective practice. So talking to your facilitators, either formally or informally, through debriefing, through reflective supervision, such that you're hearing what's happening, what's working, and what's not working. And as I mentioned before, also talking to service users about that. And one thing I was really impressed with was some of the program frameworks that both Hiroko and Millie at Momentum and Seed talked about, these really beautiful, sophisticated frameworks that are very holistic in terms of how they structure education and how they reflect the needs of community. I think in particular, Millie speaking about some of the programming with urban Indigenous peoples in Winnipeg and those holistic approaches that really reflected the needs of those communities. So thinking about your programming and structuring it in ways that reflect the needs of the learners that you're serving. And we have a tool that we've developed through Equip Healthcare. If you really want to get started at the organizational level, there's the trauma review I mentioned before. There's an individual sort of self-reflective piece, but then a group or team or organizational level discussion. But then there's also this tool, which we call our Rate Your Organization series of tools. And this one is on trauma and violence informed care or trauma and violence informed approaches. So the link is at the bottom here. And then, as I mentioned, really emphasizing the organization's responsibility to support staff well-being. That we need staff to understand that their experiences might be reflecting vicarious trauma because they're hearing a lot about what's going on in people's lives that can be quite distressing to them, and they are feeling it as trauma, even though it's happening to somebody else. And making sure that there are organizational supports for people who are in that space of feeling moral distress, vicarious trauma, and burnout. And I mentioned a moment ago that could be debriefing, reflective supervision, but also things like employee assistance programs where people can seek external counseling supported by the organization. And then organizational supports for self-care. One thing I worry about is we do sort of download the responsibility for self-care onto individual staff members and say, you know, well, just look after yourself, have some tea, and so on. We had a brilliant quote from a shelter director who was in one of our studies during COVID, who reflected that there's not any amount of tea in the world that's going to fix the patriarchy. So we really need to sort of work at multiple levels. The organization to support self-care can provide strategies like this, flexibility, quiet rooms, things like that. So, and we have all of this in our vicarious trauma tool. And again, the link is at the bottom. If you really want to go sort of next level in terms of organizational intervention, I wanted to put a little bit of new content here. In our Equip work, working with different types of services, we've now developed what we call an action kit for organizations. And it is sort of based on implementation science thinking. It's how to implement equity-oriented services. In this case, we've been talking about the trauma and violence informed door, but you know, as I mentioned before, there's also sort of harm reduction and anti-racism ways to start this. And then we've got a series of steps and related tools and supports that can get a whole organization or unit or team started on a path to equity-oriented care or trauma and violence-informed care. So that's Equip Healthcare and our Equity Action Kit. If you want sort of the, you know, the next level of implementation of these at the organizational level. So I think that is it for me. I'm going to turn it back to Rebecca to talk about some of our new resources, but Rebecca, I will advance slides for you. So just tell me when you want me to do that.
Perfect. Thank you so much, Nadine. As you said, I'd just like to quickly highlight two of Families Canada's resources that may also be of use to financial literacy educators, specifically our needs assessment and the action plan, and talk about how they could complement the work that you're doing as well. And then I'll also introduce a brand new e-module that will be available to everyone soon as well. So slide, please. First up, if you're looking for more information on barriers that may prevent women living on low incomes from accessing your financial literacy programs and services, I would highly recommend you download our needs assessment report. The link will be put in the chat and also shared at the end of the webinar. This report was created in partnership with Van City and the Canadian Credit Union Association and funded by Women and Gender Equality Canada. And this report identifies 14 social, economic, and institutional barriers that may prevent women living on low incomes from accessing financial literacy programs. The barriers there are listed on the right-hand side of the slide. And the needs assessment goes through each barrier individually and shares some of the lived experiences of women who participated in our research project. So it's a great resource for understanding how other people's lived experiences might impact their participation in your financial literacy programming. For example, one of the barriers identified is lack of trust in service providers. Slide, please. So the report really talks about the importance of relationships between women, other participants in your program, and the program facilitator, and how these relationships can play a really important role in determining if women will sign up for a financial literacy program, and after they've signed up, if they will continue to participate as well. So the women who participated in the needs assessment shared that their program facilitators' attitude and levels of sensitivity are major factors in their psychological well-being during the financial literacy education sessions. And the more engaged and understanding a financial literacy program facilitator is, the more willing they would be to attend a program. I have one of the quotes from the needs assessment up on the slide, which I think really speaks to this as well, and echoes a bit of what Nadine has shared in this webinar too. In addition to identifying barriers that prevent women living on low incomes from accessing and participating in financial literacy programs, this needs assessment report also covers women's recommendations for making financial literacy programs more accessible to them as well. Spoiler alert, the biggest recommendation was to incorporate trauma and violence informed approaches, but there's also some other recommendations in the report as well. And very importantly, even if you don't work in a formal financial literacy program, maybe financial literacy is just one component of a larger program that you work in or facilitate, that's totally okay. Many of the barriers and recommendations in this needs assessment will still be applicable to your work. A second resource that I'd like to highlight is our action plan. Slide, please. This resource was also created in partnership with Van City and the Canadian Credit Union and funded by Women and Gender Equality Canada. And this action plan is really the product of a Families Canada workshop that brought together 30 organizations, including financial institutions, nonprofits, and other government agencies. And at this workshop, everyone reflected on the needs assessment that we did, and then brainstormed and agreed on 20 actions that they thought of for adapting financial literacy programming to better support women living on low incomes in general. And obviously, one of the calls to action in there is to implement trauma and violence informed approaches and to develop training on that as well. So as you can see on this next slide, this is just kind of a summary of the discussion that happened at this workshop and some of the ideas that we really delve into in this action plan document. So next slide, please. I'll just very briefly just kind of show you a sneak peek of the content inside. There are 20 calls to action kind of divided into 3 categories. There are some preliminary calls to action related to adopting trauma and violence informed approaches. On the next slide, you can also see that there are a number of calls to action related to program outreach and delivery. And third, there are some calls to action that are more focused on systemic change as well. And really, overall, these calls to action are for anyone who has the opportunity to influence or impart financial literacy knowledge, skills, or confidence in their work with women living on low incomes. So it's really not just financial literacy program managers or facilitators who can benefit from this action plan as well. Anyone who has a role in providing access to quality programming can benefit from this action plan as well. And then, so that's the 2 resources I just wanted to quickly highlight that already exist. And finally, I'd like to highlight an upcoming learning opportunity as well for those who would like to learn more about TVIA, specifically about what it can look like in financial literacy education settings. So as the final part of the Safe Women project that we're running, we'll be launching an e-learning module at the end of March. The purpose of this course is really to help financial literacy educators and program managers understand and apply trauma and violence informed approaches while supporting women. And by the end of this course, learners will be able to provide emotionally, physically, and culturally safe, competent, and high quality interactions as part of their financial literacy education sessions. They'll be able to understand and apply some of the core elements of trauma and violence informed approaches, including recognizing the effects of trauma and responding appropriately, and demonstrate a non-judgmental and anti-discriminatory and non-stigmatizing attitude as part of their professional role. This course will take a minimum of 1 hour to complete. However, the course is also going to come with additional resources like a notebook with reflection questions for learners to fill out as they make their way through the course, which can extend the learning time for those who choose to do so. And the course links to additional tools that the learners can use to implement trauma and violence informed approaches in a guided way if they choose to use those additional resources as well. So in building this course, we really endeavored to make this a really flexible course that could meet the needs of someone who just wants to know a little bit more about TVIA and in financial literacy, and also meet the needs of someone who wants to delve deeper and really get their organization started as well. So slide, please. It was really important to us to include and identify realistic examples of how trauma and violence informed approaches can be implemented in financial literacy programs. And so we did this by engaging with professionals working in the space. A lot of the examples and case studies in the course itself came from our webinar presenters, Millie, Hiroko, and of course Nadine too. But they also came from the e-modules working group as well. We had professionals from ABC Life Literacy Canada, CPA Canada, Momentum, Prosper Canada, Vancity, Seed Winnipeg, and the Vida Center as well, who kindly participated in our project and are continuing to give their time, sharing their expertise to identify some of the best practices that they're doing in their work that are in line with the trauma and violence informed approach. And they're giving some feedback on the content that we've developed as well. Right now, this e-module is in its very last stages of review. On the next slide here, I have a very high level sample of some of the content. There are quite a few sections to the course, and we have specific case studies and plenty of tips incorporated. And you can kind of see a sample there that we do have a slide on a section on provider well-being, talking about precarious trauma and moral distress, which was what Nadine started with today and how important it is to cover that content. Next slide, please. When the e-module is published at the end of March, it will be available on Families Canada's training portal in English and in French. It's a completely 100% self-guided course, so anyone can sign up at any time. And it's our hope that this will become part of various organizations' financial literacy facilitator training process, so that people really take this on and provide this training to all of their staff. To us, this e-module represents Families Canada acting on what we learned from the needs assessment research, following up on the recommendations communicated to us by women living on low incomes, and putting into action some of the first calls to action in our action plan. So we're really looking forward to sharing the course with you at the end of the fiscal year. And those are 3 important resources that I wanted to add in at the end of this webinar. Nadine, do you have anything additional that you would like to add before the Q&A?
No, I think that's great, Rebecca. I'll just slide to our last slide here that's got links to those of us who've presented in the webinar series. I do want to thank you, Rebecca, for inviting me to be part of this. As I said, I've really learned a lot about how we can apply TVI principles in financial literacy education. So it's been a great opportunity for me. I've got links at the bottom to the different resources, and do want to highlight the fact that we have a new handbook coming out probably in May for the print version, maybe a little bit ahead of that for an online version, around how to implement trauma and violence informed care in different contexts. So we're excited about that coming as well.